Good morning, everybody. Welcome to the final day of the People's Tribunal on Economic Crime. Today we will continue canvassing the issue of state capture, and we're on a bit of a tight schedule today, so we'll be starting quite early and keeping quite strictly to time so that we can release our interim findings this evening, which we're all looking forward to. So I would, on that note, like to call upon Mr. Anele Yawa, the Secretary General of the Treatment Action Campaign, and he will be giving us some insight into the relationship between state capture as well as the health sector and the impact that state capture has had on the health sector. Mr. Anele Yawa.
Good morning to everybody. As it has been said, my name is Anele Yawa. I'm the General Secretary of Treatment Action Campaign. TAC is a membership-based organization operating in more than 250 branches with more than 6,000 paid-up members in 7 provinces. TAC is a health advocacy movement constituted by the majority of blacks, women, people living with different illnesses, poor and public healthcare users. Our members and the majority of other public healthcare users, their health lives are dependent on the quality of healthcare services provided at healthcare facility level. When the right of access to quality healthcare services is not fulfilled by the authorities, it means our rights are violated. TAC has decided to be part of this People's Tribunal on Economic Crime and Corruption. Our wish is to come here to share with you some of the incidents of corruption taking place within the public healthcare sector. Each of the TAC's more than 250 branches have adopted one or more healthcare facilities. The purpose of our branches to adopt healthcare facilities is for our branch members and community members who are healthcare users to ensure that our healthcare facilities are providing quality healthcare services for all. Through our advocacy work for quality healthcare services, we saw at first hand on how cadreship deployment, political connections, and struggle credentials has contributed to the deep corruption prevailing within the public healthcare sector, more especially at facility, local, district, and within the provincial health departments. Corruption and economic crimes is not, in our view as TAC, corruption and economic crimes is not only about stealing, but it is also about breaking procedures, systems, rules, and the law of the land by taking illegal and unlawful decisions that gives an opportunity for theft and looting to take place. Corruption and economic crimes within the public healthcare sector are also perpetuated by cadreship deployment, political connections, and struggle credentials. These narratives resulted to a situation where many senior officials within the health department are not hired based on their qualifications and competency, but because of politics and connections that are at play in determining that. The political deployees, their duty is to carry the political instruction from the political heads without questioning them. The incidence of life acid demanding is a living example. The Minister of Health of South Africa, Dr. Aaron Motsoaledi, in his oral testimony during the life acid demanding arbitration also attested that political connections, cadreship deployment, and struggle credentials has contributed to the gross violation of human rights and the provision of poor healthcare services through corrupt deals. A living example of that is the former MEC of Health in Eastern Cape, Mr. Stelo Gopana. Mr. Stelo Gopana by profession was a teacher, but he was later appointed as the MEC of Health, leading a department that he has no competency on. And as a result of that, wrong decisions were taken. And as a result of that, officials were forced by politicians to break the law in order for them to fulfill the political needs and political mandates of those politicians. TIC members across the country will tell you one or two stories of corruption at facility or at local level, and what does it mean when it comes to access of quality healthcare services. When services are not provided because someone stole money or medicines, resulting to many people not getting adequate healthcare services. During his oral testimony at Life City main arbitration, Gauteng Premier David Makura said, and I quote, "If there is a matter that threatens the financial stability in our province, it is what is happening in the Department of Health," unquote. Among the many incidents of corruption and economic crime, I would like to share with you some few stories. Firstly, let us draw some lessons on the Life City main arbitration. According to Section 27, it pointed out that since 2010, there has been almost 7 billion of irregular spending by the Gauteng Department of Health. It also shows that about 1.6 billion has been referred to special investigating units. Also, during the Life City main arbitration process, one of the things that we have observed is because of recklessness and incompetence of Qedani Mahlangu, she forced officials to take wrong decisions that led to corruption. That corruption which led to the mass murder. And after that, when they appeared at Life City main, again they took money from the public purse to defend those wrong and corrupt decisions. About 60 million rand was paid to attorneys who were defending the Gauteng Department of Health during the Life City main arbitration. Just imagine 60 million. How many lives could have been saved by that 60 million? How many people are often turned away in health facilities because they are poor, they are black? Always they are often turned away in clinics because there are no enough nurses, there is no enough medicines, and all what have you. Then we must ask ourselves, where is justice? Where is dignity? This is an example of a department that was collapsed by incompetent and corrupt officials under the stewardship of the MEC who is alive. Huge amount of money that are supposed to be allocated to improve the quality of healthcare services. This money is used to defend wrong and corrupt decisions taken by corrupt and incompetent officials and politicians in courts of law. Let us draw some lessons from what is happening in the Eastern Cape. On the 5th of February, an article from Health E-News reads as follows, the title: "The state is also captured by incompetence." Reporting to the State of Health and other services at OR Tambo District in Eastern Cape, and I quote what was on the article. According to the Auditor General's report, the reason the money was not spent, it is simply because of the officials and politicians lacked the skill and competence to manage the health sub-district. While they may not have put the money into a family wedding or a mansion in Dubai, it has not reached the people it was supposed to help. So for them, it has the same effect as if it has been stolen. Incompetence and lack of capacity takes on deadly dimension in the healthcare sector. The Eastern Cape Department of Health is facing medical legal claims totaling over 7 billion. Yet the entire annual health budget is 21 billion. The other question that we need to draw some lessons from is the question of the healthcare workers who are stealing from the public purse, also depriving the healthcare users. In many instances, some healthcare workers, more especially those working at pharmacy or have access to the issuing of medicines, they often steal medicines and medical supplies for the sole purpose of selling it out to those who don't see themselves going through the frustrations the rest of others are going through within our healthcare facilities. These healthcare workers steal medicines and medical supplies that are meant for public. As the result of that, those who were meant to receive a particular medication on that day will be turned away at facility under the guise of medical shortage or stockouts. Healthcare workers that were arrested for this in KZN, Mpumalanga and other provinces for this wrongdoing are known by the public, and the law is still taking its course. But what about those who are still doing it up to this moment, but we don't know about them? Whilst working in Free State as TAC, because I've explained that we are a membership-based organization, we received a testimonial from an elderly woman, but it was written by one of our comrades. And I would like to read it as it is. It reads as follows. An old woman in her middle 60s was babysitting her grandson who had a severe diarrhea and vomiting. She called an ambulance to take them to the hospital. Buthelezi ambulances came and picked them up, but on the way, it tried overtaking another car, only to see a truck coming that way and trying to swerve it, then lost the control and overturned to roll 4 times. Both the child and the granny were hurt, and strange part is that after freeing themselves, the paramedics then called a friend in a private car to come pick them up and drop them off at the hospital. There was no proper checkup from the hospital, and they were sent back home. After a few days later, someone visited the family and claimed they were from the Department of Health in Free State, and they asked from the granny for all files that are related to the incident. Then they went to pull out their files at the hospital. So until today, they have never heard from the government person, and all their files and information is still missing. And according to the observation of the author, the child has a disability and the granny has went blind after the accident. Before last, in 2014, between 2014 and 2015, in Free State, at Bethlehem, at Titabeng Hospital, when the former MEC of Health, Dr. Beni Malakwane, was the MEC of Health in Free State, the current MEC of Mineral Resources, Mosebenzi Zwane, was still the MEC in Free State. A family member of Mosebenzi Zwane, who happened to be the branch secretary of the ANC, was sick. Mosebenzi Zwane called Beni Malakwane to tell Beni Malakwane that my family member, who is also a member of our organization, is sick. According to the hospital rules, anyone who gets a hospital bed needs to follow a certain process. But in this case, simply because this person was connected to those who are powerful, Beni Malakwane phoned the superintendent of the hospital and instructed the superintendent of the hospital to make sure that one bed is made available for a family member and a friend. One person was removed from the ICU bed and the person died, and this one who is connected was given a bed, and up until to this day, that person is still alive. We opened the case as TAC in 2015. Up until now, the case never progressed because some of the witnesses who happened to be whistleblowers and who happened to be healthcare practitioners were scared to come forward because they were fearing for their lives and their jobs due to political terror. In conclusion, economic crimes, corruption, and capturing of the state institution is the enemy of the people. And anyone who is advocating for the unity of the corrupt is the enemy of the people because they break the spirit of unity, solidarity, and national pride. Economic crimes and corruption is stealing from the people. The money stolen, wrong decisions taken, appointment of incompetent people to strategic positions within our healthcare department has contributed to economic crimes and corruption, but that on its own, it has led to the state of a broken healthcare system. One of the reasons that we came here, we want to remind not only this tribunal, but the whole world that health is one of the fundamental rights. And anyone who steals a money that is meant for health, that person is equal to a murderer. I thank you.
That was such a rousing speech that I thought we would not have any questions, but maybe we do.
Yes, I think
thank you, Anele, and thank you for the work that the TAC is doing. I just have one question. You said in your presentation that your 250 branches throughout the 7 provinces adopts an institution or a clinic. Now, in terms of governance, systems of health institutions, there's supposed to be boards and in which the community participates. And I just wanted to hear from you, what is your experience of this form of governance which is meant to involve communities? Because our health department prides itself by saying we have democratic governance systems overseeing the health system, and maybe you have had an experience interacting with the boards here.
Thank you. Hey, this thing is too short, and I'm too short. Oh, one. There is a say in English. It is easily said than done. We do have these clinical committees by the mere name of meeting the requirements of the law or of the Constitution. But in the true sense of the word, these clinical committees are shadow committees. They are non-existent. There are no clinical committees who serves the interest of the people. When you go to these clinics and you ask as to say, when was the last meeting of the clinical committee of the hospital board, you will find out that the last meeting was about eight months or a year ago. You see the clinical committee members in hospitals, all what they are doing, they serve as queue workers, and sometimes they go to shops and buy lunch for the nurses. And also in terms of the government regulations, it is the duty of the MEC to ensure that hospital boards and clinical committees are formed. But when you engage MECs and you begin to ask them, which policy or guiding document that governs the operations of clinical committees and hospital boards, you won't get it. But also, you find out that as much as the MECs have powers to appoint clinical committees and hospital boards, they are not capacitated. They just appoint them and leave them in the cold. And as the result of that, some of the clinic committees, they end up being involved in some of these corrupt acts, but at times, some of these clinic committee members, they don't know their roles. It is against that background where we as TAC, in the name of the communities and in the name of our lives, we make sure that we hold hospital authorities and clinic committees accountable and begin to ask them critical questions as to say, why are you not holding meetings? And it's only then that they come forward and tell us as to say, what is their frustrations? So we don't have clinic committees and hospital boards. They are only there by the mere name. You can go to Telemohoran. We were there not long ago. We engaged the CEO. We asked them about the hospital board. We asked the minutes. It was difficult for them to show us the minutes of the last meeting. So that on its own shows that they are not non-existent.
Just to follow up to that, there was a dispute between the TAC and the MEC of the Free State, Dr. Benny Malekwane. Would you enlighten the panel about what happened, what the nature of the dispute was all about, and where it is? Yeah.
One, Dr. Benny Malekwane, before he was appointed as the MEC of Health in Free State, he was a municipal manager in one of the municipalities. And in the process of him being a municipal manager, it happened that a lot of monies from that municipality was unaccounted for. And he had I think he had about 3 criminal charges against him for his involvement. After that, he was appointed as the MEC of Health. The first thing he did as the MEC of Health is similar to what Dani Mahlangu did in Gauteng to cut the cost. He introduced this thing of cutting the cost. So to cut the cost, according to him, he had to get rid of more than 3,000 community healthcare workers. These community healthcare workers, in our view, they are the foot soldiers. They help to make sure that services are provided, because we all know that our healthcare system is broken. It was the duty of these community healthcare workers to provide home-based care service, tracing defaulters, and also providing treatment to those who were bedridden. Benny Malekwane dismissed all of them, and after that, he hired NGOs to do the same work of the community healthcare workers. We fought against that, but also within Free State, there were a lot of shortages of drugs. Many hospitals and clinics were shut down. You go to some of the hospitals, lifts were not working, and there was a lot of healthcare workers who were resigning from the system because of the frustrations they were going through.
Okay, thank you very much, Anele.
Okay. Thank you very much. That was a good presentation to start the morning. Thank you very much for taking the trouble to come, and I think you have made an important contribution. So thank you very much indeed.